I've done some research, and I've actually used this product at home, and I really think it's an awesome product. I can tell you that it's cut down on the odor. I have a pet monkey at home. Daisy is a mess. So not all monkeys throw poop, but you wouldn't know that by looking at some of their stuff. There's food everywhere. She doesn't wear a diaper. There's poop everywhere. Keeping her area clean has been a pain in the butt, and I've always been able to tell how dirty things are by the smell. Of course, you try to clean them every day, but I don't have a chance to clean them every day. My point is, since I've been using the BioVet, since I've been using my sniffer to know when it was time to clean it, I find myself cleaning now not as often as I used to. That's not good as far as monkey husbandry goes, but it does tend to work there. I even was able to use it on the cane toad in its enclosure, and I can't use any of the chemicals on amphibians' cage. I mean, they absorb so much stuff through their thing, but since this is one of those ubiquitous in nature type organisms, it's not going to harm your amphibians. I have yet to be able to test it in a fish, but I'm sure it'll make a difference when the time comes when I get those chance to do those products. Turtles. As a matter of fact, I didn't tell you this yet, but I did use it to flush a wound that had a bunch of maggots and stuff in it. I really can't say it helped that turtle, but I will say that the turtle didn't have any toxic side effects. The point is, before it left the hospital, you couldn't smell the maggot infection. Yeah. Okay, so I've been impressed in a lot of ways. Anyway, so I guess what I'm trying to say is, if we're looking at the hospital microbiome or the microbiome of our patients, if we're putting a controllable factor in there that's not going to kill, the good bacteria. That's right. Okay, and it's going to, but actually outperform or outcompete the bad bacteria, then this product should be awesome.
Yes.
And the fact that, and you don't know this yet, but chances are, with the way this bacteria works and the way this bacteria cleans and the surfactant it even produces, okay, I've been doing a lot of studying, just being around that bacteria makes the other surfaces that much cleaner.
That's right.
So this is an awesome product. Again, I have quaternary ammonium compounds, the bleach compounds. All these things are quite toxic to us. We find it.
And they're on revision 9? The new generations that keep coming out because the old generations just don't work anymore. Not as effective.
These organisms get resistant to it, and this is one way. Seeing as how let me put it this way: if that cleaner had a will of its own, okay, then it would probably outcompete and outclean the other things that are trying to live amongst it. Right. But it doesn't. But it turns out that the BioVet product does have a will of its own, and it will outcompete, and it will keep those other things at bay.
That's right. Have you had any experience with biofilm and using the BioVet product?
Well, I am doing my own little home experiment. I have one of Daisy's cups that I've been actually spraying with it very, very regularly. It's a rubber plastic cup that folds in and out. It was part of her cage. She likes her cups. I've been trying to save it. I let it sit outside for about a month, and it got this nasty stuff, this black stuff all over it. Although I have not gotten it completely sparkly green like I was hoping for, I will tell you that I can't scrape any more biofilm off the bottom.
Very good.
It is just stained rubber at this point in time.
So these bacteria do clean down to that microscopic level. And, and they do have an effect on biofilm.
This bacteria, again, since it's ubiquitous in nature and it's part of breaking everything down, it will, how do I put this? The chemicals it produces is a biosurfactant.
That's right.
Okay, that's how it works in nature.
That's right.
If you're putting that on your floor and it's as safe or safer than the ground outside,
that's right.
Then it's an awesome product. And again, you can use it for exotics.
Yep. And for the exact thing, when you were talking about antibiotics and the side effects of using antibiotics, where you're wiping out all the bacteria, and that it's doing the same thing for your surfaces in your hospital. And if you wipe out all the good and the bad bacteria, there's no competition for those rapidly replicating bad bacteria. So the good bacteria is what gives them that competition. So this is very, very similar to antibiotic therapy.
And this is one of those bacteria, again, that can be sporulated, which means when it's gone and all the ATP and all the food and the biofilm is gone, it's going to be there, and in its little sporulated form, waiting for the next time something else pops up, the next blood spill, the next piece of poop that hits the floor. Right. It's going to be there to help break that down. Yep. So, it's basically, it's creating a microbiome in the hospital. that very little can get through. It's never slowed
Well,
us
let's
down
talk about
before.
some other places that BioVet could be used in the hospital. When you have a patient that's in a cage that's boarding for, let's say, 3 days, every time that patient walks, it is appropriate to just clean that patient. There's no cross-contamination, so it's appropriate to clean that cage and not disinfect every time that patient goes out to walk. So
Right.
Other areas such as mopping your floors. We talked about some hospitals are cleaning with disinfectants, and their intention is to kill all good and all bad bacteria with their cleaning processes. When you're cleaning or mopping your floors with BioVet, you're restoring that healthy microbiome and giving competition to those pathogens that, as we discussed in the opening, that these pathogens, or BioVet prevents these pathogens from reforming on surfaces because they're just inundating the food source.
Actually, and as you were talking there, I just remember one other thing. I remember a case, guys, this is over a decade ago. We had a small Chihuahua in, it had COPD. They were doing breathing treatments on this animal for a while. We ended up having to board it at the hospital. And the dog went out for a slow walk. While it was gone, one of the girls had cleaned it. Back then, they used a lot of bleach. When the animal came back into the hospital, it came back into the hospital before the bleach had dissipated, in the environment. And that dog was having breathing issues in the cage. I remember us rushing it out, and we couldn't figure out what it was at the beginning. But then one of the girls had just said, "I just cleaned the cage," and we came to the conclusion it was the bleach because we still smelled it.
Yep.
But we didn't know or didn't think that dog was going to be affected by it.
Yep.
So you're cleaning this cage, but again, the chemicals that are in the air.
The chemicals that we use when we mop the floors, and your patients don't come in wearing shoes.
That is true.
And so they're getting this on their paws and tracking it with them. We talked about transference, just like we are going to transfer good bacteria to your camera to clean. We transfer bad bacteria in the same way with our feet and with our hands, with their paws. So if you can move good bacteria from an area that's been clean to an area that has not been clean, it's the same thing we're doing with your phone there.
Yeah.
So.
Camera.
I'm used to doing phones, so